our case, Jessica, someone who was previously active and familiar with exercise, then you can kind of just continue with what you were doing for the most part. You just have to keep in mind certain guidelines, which we're going to go over next. Now, if you were someone who was previously sedentary, so someone who wasn't very active, not too familiar with exercise, then you want to have a bit of a gradual approach, also keeping in mind these guidelines. So where do we go from here? Whenever we think of exercise prescription, we think of FIT. So frequency, intensity, time, and type of exercise. So these are all the parameters we need when we're looking to prescribe an exercise. Now, the information we're pulling from today is from the most recent recommendations and guidelines from the Canadian Society of Exercise Physiology and the College of Obstetricians and Gynecologists in Canada. And these recommendations are from 2019, so pretty recent. So frequency, how often should you be exercising? So typically, the recommendations recommend at least 3 days a week. And this can be more or less, but that should be kind of the average accumulation of exercise. And that being said, even if it's just 3 to 4 days a week, you want to, being active every day, whether it's doing some light yoga or walking, is encouraged. Intensity. So we get a lot of questions about this just because there's a lot of different information out there. There's a lot of confusion around this. So we want to throw it out to you guys first to see what you think. So true or false, you should keep your heart rate under 140 beats per minute when exercising while pregnant. What do you guys think? If you don't mind, throw it into the chat. We just want to see what the audience thinks. So we'll just give you a few seconds to do that. Go ahead, throw it in the chat there. False, 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 true, false. Okay. A little bit of both, Good. Okay, so we definitely see a mixed bag here. Good. Okay, so let's find out what the answer is. The answer is false. The reason being, during pregnancy, at your maximal exercise levels, there's actually a blunted heart rate response in pregnancy compared to the non-pregnant state. So when you're monitoring your heart rate target zone, you actually want to modify it. Now, the best way to monitor this exercise is going to be a combination of things. It's going to be looking at a modified heart rate based on a couple of factors. It's going to look at rate of perceived exertion. These are kind of the things that we find best to monitor where you should be exercising. So heart rate. So because of that blunted response that we see in pregnancy, we have to take in a couple other factors. We have to look at the maternal age. We have to look at your fitness level and or BMI. And that gives us that heart rate range that you should be working in. Now, of course, not everyone is going to have this handy or have a tool to monitor their heart rate. And that's okay. Another common tool we use or recommend in clinic is called the talk test. And it's as simple as it sounds. Basically, when you're exercising, can you still carry out a conversation? You should be able to still talk, but you shouldn't be completely breathless. Rate of perceived exertion. This is another tool that the guidelines recommend for monitoring your intensity. And this is called the Borg rating of perceived exertion. So it goes from 6 to 20, 6 being totally rested and 20 being you're at your maximal exercise level. In pregnancy, the current guidelines recommend that you should be from a 12 to 14, which is a somewhat hard or a moderate intensity on this scale. So when exercising, consider all these things. Consider the target heart rate based on your age, your fitness level, your BMI, consider the talk test, and consider this Borg scale. And you should be at a moderate intensity. That is what the recommendations state. Time. So how the amount of exercise I should be working. And the guidelines suggest it should be about 150 minutes of moderate intensity exercise each week. Now, if you were someone like Jessica, who was previously active, you want to start with 30 minutes or even more, because you're familiar with exercise, you've done it before. Whereas if you're someone who was sedentary, you want to start with about 5 to 10 minute bouts and work your way up. And in this time, it's also important to remember that you definitely want to include some sort of warm up, including getting the heart rate up, a nice dynamic stretch, activation, and then a cool down. So cooling down that heart rate, doing some static stretching. That's also important to incorporate into the time that you're exercising. I'm going to pass it over to Amrita now. She's going to tell you about the types of exercise we should be doing in pregnancy.
Okay, so I'm going to throw it out there to you guys now. Do you guys think there is one best type of exercise to be doing during pregnancy? And if you do, then what do you think that it would be? Throw it into the chat. Okay,
Any
so we're not
guesses
getting.
out there? Oh, there's one.
Yeah, okay, we're getting yoga, cardio strength coming in. Yoga, whatever works best. Low impact Pilates. Okay, so there's a bit of a delay. Okay, so I am going to leave you guys in suspense for a bit. We're gonna go through some more true and falses with respect to exercise, and then we will give you the true answer at the end. All right, so true or false. We want you guys to participate on this one. Running during pregnancy is considered unsafe. What do you guys think? Wow, so a lot of falses, a lot of falses. Okay, I guess we did not trick you guys on that one because you are right. So the answer is false. There is currently no such evidence finding that running is considered inappropriate during pregnancy. However, it is suggested for women that are familiar with it pre-pregnancy. So now in terms of the research that has been done on running in pregnant women, they have only tested them at a moderate intensity of exercise. They do not know what happens above that level. So as long as you're at a moderate level or below, you are safe with respect to running during pregnancy.
All right, guys, true or false? Pregnant women should avoid lying on their back when doing exercise. What do you think? Throw it in the chat. Let's see. Bit of a mixed bag here. True, false, true, false. Yeah, okay. Good, true in the second. Okay, false. Yeah, so definitely a mixed bag with this one. So the answer is a mixed bag, true and false. So when you're exercising on your back, a big reason people usually say to kind of avoid that or be careful with that is because of something that can happen where the uterus is pressing down on a big blood vessel called your vena cava. And this can cause symptoms of lightheadedness, dizziness, or feeling of nausea, and just general feeling unwell. And that can happen with some women. And if that is the case, that does mean there is blood flow being disrupted. And if that does happen to you, make sure you immediately lay onto your left side. That will help decompress the blood vessel. Now, with certain women, they'll be able to lay on their back and they'll never get this response. It just won't happen. And that's okay. It's important that you monitor for this response, like make sure you're monitoring for the lightheadedness, dizziness, that sort of thing when you're on your back. But if you're someone who never gets this response, it's absolutely okay to keep exercising on your back. There's a lot of good core and other exercises you can do on your back. But if you are someone who feels like every time they lay on their back, they get these symptoms, it's quite frequent, and then you might want to look at some other positions to exercise and modify accordingly.
Okay, true or false, guys? Pregnant women should avoid abdominal exercises because it may lead to abdominal separation. We get this question all the time. What do you guys think? All right, so a lot of falses. True ones showing. False, false. All right, let's find out the real answer. Okay, so the answer is false. So all women are going to have some amount of diastasis recti during pregnancy, as we have discussed earlier. Abdominal exercises are actually safe and needed during pregnancy, but the key is learning how to engage your abdominals within that safe tension range for your specific musculature and fascia and situation. And this is where potentially an assessment with a perinatal health provider may come in handy, just to figure out what that safe tension range is for you. It's also important to learn how to engage your abdominals to work along with your pelvic floor muscles in labor, and it can result in a potentially more comfortable labor that way. So that is good news to all of us, I'm sure. So going back to our original question, what is the best type of exercise to do in pregnancy? Has that changed your mind at all? Do you think there is one best exercise, or do you think that there isn't one best exercise? Let's find out. It depends. There isn't. You are right. There is actually no one best exercise to do during pregnancy. The key is to do a variety of exercises during pregnancy so you are not overusing certain musculature and potentially risking injury that way too. So we want you guys to have a variety of these types of exercises throughout your pregnancy. Aerobic exercise like cycling, brisk walking or running, resistance exercises like strength training with bands or weights, yoga, Pilates, or gentle stretching. These all count as exercises. Pelvic floor training is actually pretty hard. It can get your heart rate up as well, and that does count as an exercise to do during pregnancy. So you want to stay within this nice variety of exercises. Okay, with that, I'm going to pass it over to our pelvic floor physiotherapist, Alana. She's going to be chatting with you guys about Jessica again and just about her concerns about resuming the exercise program.
Yes, so we take it back to Jessica, right? She was 22 weeks pregnant, first child, very active pre-pregnancy. She did CrossFit running, and she kind of stopped exercising because of the pandemic and because she just wasn't feeling very well in her first trimester. Now she's ready to return. So what would her exercise plan look like? So based on the most recent recommendations for exercise in pregnancy, for frequency, she could start right with 3 days a week. And this is because she was someone who was familiar with exercise. She's done it before. She was active pre-pregnancy. And she could progress to 4 or 5 even if she wanted. And the reason we say start with 3 is because she did have that first trimester off. So we want her to kind of ease back into it. Intensity. So again, we want that moderate intensity of exercise for all pregnant women. And these are based on those recommendations. Now, with Jessica, we just want to coach her on monitoring that intensity, whether it's through her target heart rate based on her age, fitness level, BMI, using the talk test, or using that somewhat hard on the Borg scale that we showed you. Time. So again, Jessica was previously active, so she can start right with 30 minutes. That's no problem. She can even bump it up to 45 minutes. However, if she was someone who wasn't very active, she'd want to do smaller bouts, but for her, 30 minutes should be good as long as she's listening to her body. And type, what type should she be doing? So we want her to do what she enjoys. If she enjoys CrossFit and running, she can absolutely continue with that. Again, she just got to listen to her body and modify accordingly. So you may be thinking, after hearing all those guidelines and recommendations, you're still not sure what you should be doing and what's best for you. And that is okay. There is tons of information out there. It can be quite overwhelming. And we have to consider that everyone's different. Everyone has different goals and different needs, and every pregnancy looks different. So again, you are not alone. But this is a big reason why Amrita and I came together to form the F.I.T. Pregnancy and Postpartum program.